God a bigger applause, please. Praise the Lord. That was all the questions. We asked you to write down questions when they Alright, so it's time for questions. SARS and
this charge that sometimes comes is milky. This is the white milk we are all familiar with. If you are not nursing a baby or you are not pregnant and you have milky discharge from your breast, again, it is a matter that would need to be investigated, but generally speaking, it does not portend to anything terribly wrong. You will need to see your doctor so that the doctor will examine you, investigate it if necessary. There are some types of cancer that can cause milky discharge. Prolactinoma is one of those. But again, the best thing to do is go to see your doctor so that it can properly be investigated and examined. The third type of discharge that can come from the nipple is pus, purulent. When you have pus coming from your nipple, it suggests infection. I think we all know that. I don't need to say any more about it. And finally, the ominous discharge from the breast that should be of greatest concern, just like our sister shared, is bloody discharge. That is where, whether you press it or you accidentally bumped against something, there is blood that is coming from your nipple. That is ominous. It almost always suggests some form of growth. Again, you need to see your doctor so that you can properly examine and any necessary investigations done. So I have said there are 4 main types of discharge that can come from your nipple. If it is clear, generally it's not of great concern. It should be episodic and should go away. If it persists, you need to see your doctor to investigate it. Second is milky discharge. Again, if it is related to your pregnancy and or one-time thing is not of major concern. If it persists and you are not pregnant and you are not nursing a baby, you need to be investigated. The third one, as I said, is pus. Anywhere we know that when you have pus, there's evidence of infection, you need to see the doctor so that appropriate antibiotics can be given to you to treat that problem. And sometimes require surgery to remove the source of the infection. And finally, I said bloody discharge. Bloody nipple discharge, until proven otherwise, is a suggestion or at least a suspicion of malignancy of breast cancer. I hope I've answered the question. Thank you.
Thank you, Prof. The second one affects us generally. It's a privilege to be here to give this vote of thanks. I'll start with the speakers, the professors, the doctors who have in our midst. It will interest us to know that these people are international resource persons. We inform them, they have tight schedules. I know Dr. Koko was outside the country 2 weeks ago. You know, these people have tight schedules, and because of today's event, they deemed it wise that they have to be here to share their experiences in the field. They have been handling cancer patients. So they are telling us a lot of things, experiences that have gathered all over the years. And I believe most of us today, in one way or the other, have benefited from this wide experience. We say thank you very much, our professors here. I will quickly like to mention the pressmen, the Rivers State Television Authority, the Radio Rivers, the Radio Port Harcourt, Garden City Radio, and the Times newspaper. Before now, we've been going on air talking about this breast cancer, get involved, get inspired, get involved. And it will be all interesting to know that when we get to these television stations and radio stations, the first thing they will tell us, provided it's a health issue, it concerns women and part of it. Most of the time, the time, on air time they will give us, okay, one of them guys will tell us, okay, it's 60,000 for 30 minutes. But I'm going to give it to you free of charge. Because why? You are talking about an issue that concerns women. And these people, you look at the support they are giving, that is highest they can give. They want this message to get to everyone. And today we are going to say thank you very much for what you are doing. The representative of different organizations, feeders, they were here today. The nursing school, School of Midwifery, they came here today. The caterers, they have been so wonderful. I don't even know how much we pay them, but they say, this is concerns women. I'm a woman myself, I'm talking about the owner of the Annabella group. I'm going to be part of it. Just anything you can give me, I will take care of it. And wonderfully, I know all of us today, we are happily here, and all of us are fair. I know they did a wonderful work. Thank you very much, Annabella Group. The cameramen, you who have been very wonderful, being supportive. And I must probably mention ISEC Group. ISEC Group, they are volunteer groups from different institutions. These people came, despite the fact they are students, they took time. They came here yesterday to make sure that this hall is the way we are seeing it today. And today they everybody came. These people deserve a wonderful applause. Please, let's give them one. They have been so wonderful. They have been so supportive. Finally, I would probably like to mention the All Peace of Health Foundation and Preventive Healthcare Initiative. These people have been so wonderful. You know, when we were here yesterday, they said planning event is really not easy. We are here even as at 9 o'clock p.m., 10 o'clock. We left our house as early as 6 a.m. and as at 9 we are still out. And you see the kind of the passion, the passionate desire in these people I'm mentioning now is really moving. Even if you don't want to get involved, seriously, when you see the passion involved in this, you must get involved. So I must thank LP Sophia Foundation Group and Preventive Healthcare Initiative. Their staff have been so wonderful in planning, logistics, and making sure that today's event is a worthy one. I say thank you very much. The chairman and honorable guest speakers, ladies and gentlemen, I must equally use this final note to say, breast cancer, as we have always had, is not really a women issue. It's not really a particular set of people. Please, whatever we have learned today, I know it has been so wonderful. Please help us preach this message to everyone. We thank our mommy who has given us her own life story. She's suffering from diabetes, hypertension, and breast cancer, all to herself. And she's still living healthy. You can see her smiling. It's a wonderful experience. Please, I'm urging all of us today, do not keep to yourself. Do not keep this experience to yourself. What you have learned today might help somebody tomorrow. You might give somebody another chance to live. Please, I urge each of every one of us to share this message we have learned today. And on this note, it's been a great pleasure. When we started, we were thinking it's not going to come to an end. But a lot of people have been so supportive. We have a lot of sponsors, people that supported us both in kind and in cash, that made this occasion worth it. We really appreciate you all. We say may the good Lord bless you all. Thank you very much and have a wonderful day.